Our cost of inventory has gone down because we're able to order just the pre-packs and the amounts of the medications that we need. We have been able to keep track of inventory better because we have the pre-packs, and we're able to kind of keep account of what we have on hand, which is much better than it was prior to having VetSource.
As far as sleep product, VetSource has definitely lowered operating costs because we don't have to carry as much in the hospital. So I think that that's been probably the biggest benefit.
The changeover from our normal pharmacy inventory of veterinary practice to utilizing the home delivery and the VetSource ScriptWrite platform has definitely allowed us to not only minimize a lot of the super products we have, but also increase the ability to get clients on long-term refills. So it has definitely impacted how much we have to order, and the turnover of our inventory is much better because it's much leaner. And so the costs of time related with managing the in-hospital inventory have definitely gone down, and you know, we have seen better long-term client fulfillment and reorder points because we can auto ship things very easily when we know they need it.
It has really reduced our inventory expenses that we have here. We can get all different kinds of medications and supplements and prescription food for our clients through there.
VetSource has had a huge effect on our inventory. It allows us to minimize the amount that we have in clinic, so allowing us to offer more to our clients at a lower cost. I think that's been one of the major things, is the limit to what we have on the shelf, being that we're a very small clinic. It allows the doctors to use more medications broadly.
We don't have the carrying costs and ordering, the stocking, you know, all of that. That's made a big difference.
VetSource has improved our efficiency significantly. Staff time, not having to spend time filling medications, not having to spend time talking to clients about how many pills they want and things like that. We have a set amount of pills that we can give them. It's improved efficiency and compliance among clients as far as having them return for recheck visits. When we've prescribed 30 days of antibiotics, we're able to put in a recall and have them come back in quickly and on time for their rechecks.
It's made it a lot easier. Knowing which products are on VetSource has allowed me to be a little bit quicker on knowing what's on my shelf versus what's not, and what I can do to get the clients in and out quickly.
VetSource has increased our efficiency because we don't have to store as much product, and we can frequently send people away and just have stuff shipped right to their house.
I think the Dispense Ready, along with the ScriptWrite as a total package, is really how you can manage it and change your pharmacy cost structure and efficiency in your hospital in a dramatic way.
VetSource has affected the efficiency here greatly. It's really helped the fluency of everything, timely manner of getting prescriptions to our clients quickly.
I think now it's easier than filling a prescription in clinic. It literally is a couple clicks away. It allows good communication between the staff in the back and the receptionist or the people checking out in front. So I think it's allowed for a more efficient and effective check-in, check-out process, and owner gets their medications right away. It's really made a big difference in a positive way, I think.
Easy to deal with. If we have a question, we just call them up and there's usually an answer, and issues are resolved in a manner that seems to be very complimentary to us and the client. So I appreciate the client service that we get.
VetSource's customer service has been really good. It's been they handle our problems almost instantaneously.
I think that the VetSource customer service is great. That's probably one of my favorite parts about VetSource, is that we're able to call. You can get to someone within 15 or 20 seconds. They always take their time right then to help you. There's no holding. There's no waiting for them to get back with you later on in the day. It's easy to get to your ISR. It's easy to get to a pharmacist if you have pharmacy questions. Anytime there's been any sort of small problem, they're able to fix it immediately for us and for the client, and they're unbelievable. They're awesome.
We always have somebody with a positive, energetic attitude, which makes it really nice to work with. And they've always given us feedback on how we can prevent future problems from reoccurring. So I kind of like to follow through with them as well.
Our customer response has been overall really positive. Everybody seems to enjoy the options that come with VetSource and being able to get their prescriptions relatively quickly.
We always ask the customers after they've had it a couple months how they like it. Their always expressions are that the customer loves it. So I think that if it's something that a hospital can implement to their services, I think it would be a great idea.
So most clients are accepted of it. We still have some pushback, but once we've got them into the system, it's very rare that they get out of it, meaning like, I don't want to do this anymore, I don't like it. Most people like the efficiency of that when we talk to them, and new clients now really like the fact that it's like, hey, you're going to get it to me home, and automatic refill or whatever the scenario may be. Most of them are very accepting of that.
Customer responses are usually pretty good. Everybody really likes getting the flea products once a month. They don't have to worry about when stuff's coming or when they need to apply things.
The clients that we have had on VetSource have all been very pleased with the service. They all find it very easy to use. They're able to log into their own portal through our website and set up their own prescriptions that they need. We've had a lot of times where we've been able to assist clients who maybe ordered the wrong medication. Since we have the final approval, we're able to go in and call them and say, Mrs. Jones, you've previously been on levothyroxine and you ordered these canine thyroid chew tabs. Is that what you really wanted to be on? Versus some of the other pharmacies, maybe online pharmacies, that we don't really get to approve what they're ordering. So it's been helpful to clients. I think that they've all really enjoyed having VetSource as an option.
I would tell other hospitals considering using VetSource that it is worthwhile, worth trying.
The best thing I like about it is the major part of it is the ease. Being able to have these clients at home, being able to order things, not having to come in, because right now it's more about convenience than anything else.
I would say to other hospitals considering using VetSource that it is a wonderful program. It's a great way to build compliance among your clients. It's a great way to have staff time cut. It's an easy way for the staff to see prescriptions, look in your practice management software to determine refill amounts and expiration dates. It's all in an easy portal, and you have final approval of everything, which we love because we're able to catch mistakes that we might not be able to catch if an employee were to just approve a medication on paper and fax it into another pharmacy. So it's a great system.
I would say to other vet clinics that VetSource is probably the best thing that we've done in this clinic besides expanding to a two-doctor practice. I think it overall has given the clients, the staff, the doctors freer range of products. It's also made a big difference in the care and the health of the patients.
I always go back to the issue of that the pharmacy is changing, and my partner and I have known that for 10 years. We've been looking at a way to kind of stay ahead of the curve. The cost structure, the ability to save money in decreasing inventory carrying costs, the efficiencies of staff, all those things play into that. So I think they need to look at a model like this. The technology of the ScriptWrite platform, I think, is huge in getting people to understand how valuable it would be in their practice. And once they get a handle on what the ScriptWrite does for them and their staff, all our staff is very comfortable with it, it's very seamless. So I think everybody needs to look at it because that's the second largest cost in your hospital is your inventory issues. And if you can trim that down by percentage points, that's money to the owner. That's the bottom line. So it makes a big difference.